Today, we're going to be medical detectives. We're diving into a story that starts with something super common, a bad ankle sprain, but it leads us to a real puzzle in the operating room. And, as it turns out, the main culprit might have been hiding in plain sight this whole time.
So let's just get right to it. Here's the central mystery. There's a pretty standard and usually effective surgery for a specific type of ankle injury. But it just doesn't work for everybody. And for years, doctors have been scratching their heads trying to figure out why. What is the missing piece of this puzzle?
Okay, to really get this, you need to know about the injury itself. It's called an osteochondral lesion of the talus, or OLT for short. Now, the easiest way to picture this is to think of the smooth, slick cartilage in your ankle joint as a perfectly paved road. An OLT is like a nasty pothole that forms on that road. It damages both the surface cartilage and the bone right underneath. This can happen in, get this, up to half of all ankle sprains, and it is a major cause of nagging ankle-ing.
Now, the go-to surgery for this is called bone marrow stimulation. What surgeons do is they basically create tiny little cracks right at the injury site. The idea is to kickstart a healing response from your bone marrow, kind of like calling in a road crew to patch that pothole using your body's own materials. But here's the kicker. It doesn't always work. Somewhere between 10 and 35% of people still have pain and problems even after the surgery. That is not a small number, and that's exactly why researchers started this investigation.
So, if you're an investigator, where do you start looking for clues? Well, the researchers turned their attention to a prime suspect, a real known offender in the world of orthopedics, a lifestyle choice that has a long and pretty terrible reputation when it comes to our bones.
Let's just take a look at the rap sheet here. Smoking has been linked to a whole laundry list of bone and joint problems. We're talking about broken bones that take forever to heal, osteoporosis, a higher risk of fractures in the first place, and even worse results in similar surgeries on the knee. See, nicotine is a vasoconstrictor, which is a fancy way of saying it clamps down on your blood vessels. This starves your tissues of the oxygen and all the good stuff they desperately need to heal. So the big question became, could this be it? Could smoking be the hidden variable that explains why one person walks away from the surgery feeling great while another is left dealing with pain for months or even years? This became the central hypothesis, the big question these medical detectives set out to answer. So how do you prove it? Well, they set up a study designed to put smoking directly under the microscope. And the best way to do that was to compare two very different groups of people. What they did is called a retrospective study. It just means they went back and looked at the case files of 104 patients who had all had the exact same surgery for their ankle. Then they did something simple but really important. They sorted them into two groups. So on one side, you have your smoking group, 28 people who were active smokers before the operation and kept smoking while they were supposed to be recovering. And on the other side, you have the non-smoking group, 76 people who had never smoked at all. Okay, the stage is set. Now the researchers could compare their results head to head. All right, so after sifting through all the data from these 104 people, the investigation came to a close. And the finding, well, it wasn't subtle. It was clear, it was direct, and it was undeniable. And the verdict? Guilty. Smoking was significantly, without a doubt, linked to worse outcomes after the surgery. This wasn't just a guess anymore. The numbers proved it. And when you look at the data, wow, it's pretty stark. They use these standard scoring systems where, a higher score means you're doing better. Non-smokers just crushed it every time. For overall ankle function, they scored a 92.2, almost 5 points higher than smokers. Same story for general function, but check this out. This is the one that really gets me. Pain. On a scale of 0 to 10, the non-smokers reported a median pain level of 0. No pain. The smokers? A 2. In every single important category, the evidence pointed in exactly the same direction. But hold on, because the story doesn't stop there. This is where it gets really interesting. The investigators found something deeper, that smoking doesn't just act on its own. It's actually a team player, and it makes other problems way, way worse. So here's the real insight. It's not as simple as smoking equals a bad outcome. It's more complicated and honestly more dangerous than that. Smoking interacts with other things, like how big your injury is or how old you are, and it magnifies the negative effects. It's like pouring gasoline on a fire. So the first issue was the size of that pothole in the ankle. The study found a really strong connection here.
If the injury was small, yeah, there was a difference between smokers and non-smokers. But as that injury got bigger, the gap in their ankle function became a massive canyon. For a smoker, a bigger injury isn't just a little worse, it's dramatically worse.
The second thing was getting back to sports or other high-level activities. And here, smoking delivered a nasty 1-2 punch. The negative impact was especially bad for smokers who were over 32 years old, and it was also much worse for smokers whose injury was on the larger side. For these folks, smoking could literally be the thing that keeps them on the sidelines for good.
I mean, the study's authors spelled it out pretty clearly in their conclusion. They said that smokers over 32 or those with larger injuries were just plain less likely to get back to the activities they loved. It's a really stark warning about how all these risk factors can pile on top of each other.
Okay, so we've cracked the case, we've identified the culprit, and we've seen the damage it can do. Now we get to the most important part of all. What does all of this mean for you, for the patient? What's the real takeaway here?
This is it. This is the single most important sentence you're going to hear. Yes, smoking is a powerful risk factor, but, and this is a huge but, it is a modifiable one. That means it's something you can change. Unlike your age or the size of your injury, this one is in your hands.
And that's why this research is so important. It finally gives us a critical piece of the puzzle of surgical success. It proves, with hard evidence, how much our lifestyle choices directly affect our medical results. But more than anything, it empowers you, the patient, to take an active role in your own healing journey. It's really no surprise that the study's authors ended up strongly recommending that patients quit smoking.
So I'll leave you with this to think about. We now know that what you do before you even get to the hospital can have a massive impact on what happens after. So knowing that you hold one of the most important keys to your own recovery in your own hands, how are you going to choose to unlock that potential before the surgery even begins?